Okay, thanks, Professor Shi. And it's my honor to have presentation for this conference. Now, we would like to introduce research and prospects of artificial intelligence in traditional Chinese medicine. And I am from Beijing Jiaotong University in the Institute of Medical Intelligence. Now we will have the 5 aspects to introduce the research and related work. You know that traditional Chinese medicine is one of the oldest healing systems that have the special, very special series and diagnostic methods, such as looking, listening, smelling, and asking and touching, which as the diagnostic methods, and also they will have the very special treatment methods, such as herbal medicine and acupuncture, massages, and some other similar therapies. In particular, in the long histories with more than 2,000 clinic practice, TCM, traditional Chinese medicine, has accumulated a large amount of knowledge and also the real world clinical data, which would be useful for artificial intelligence research, and also the similar tasks such as data mining and also knowledge discovery tasks. So for the not so, I think it's not so short history of artificial intelligence. Also, you can see that TCM, TCM in TCM field, we also can see some of the. I think it's not too such as some of the research which is developed in about 19 and 70s, such as one of the first medical expert system in China, which is focused on the diagnosis and treatment of liver disease. And following this related work, some other related researchers also have been developed, and some of the related technicals have been researched in the long histories in artificial intelligence. But I think the main research topics, in artificial intelligence in TCM, and also data mining, in TCM, you can see that from the analysis and information perspective of in this field, we can see that we will have some of the different data elements and the data fields, such as the manifestations and the diagnosis and the clinical therapies, which we can consider that this is as the 3 main components of the data elements, and could be used for artificial intelligence. For example, we can use we can use a symptom and send as a input or as a future to have the diagnosis for syndrome. Syndrome, this is a very, very special diagnosis for TCM. Then this will be considered a procedure of the syndrome differentiation. Then this is a typical classification or as a supervised learning procedure. So another related work such as some very special research topics, such as herbal combination. This is very special in TCM because the clinical therapy of TCM is a kind of very complex herbal combination, such as formula, which we can see that this is a kind of complex system which is introduced by previous slides as Professor Han. So another one, we can just connect the different elements between TCM and also modern medicine, such as symptom to disease and the herb to disease. This we can investigate a different association between these novel relation types. We can use different machine learning and also the knowledge graph to investigate different knowledge. For the methodological approach, which has been used by the different AI in TCM, we have some different resources such as bibliographic literature database such as PubMed and also the special subsets of TCM, and also we will have some TCM medical ontologies, which is developed by TCM in TCM field. Also, we can have some subject-specific database or its knowledge base, such as Simple Map, which is specialized for the work of drug discovery. Also we can have some of the large-scale data from clinical database, which is mainly collected from electronic medical record. This is an example for one of the sources, such as SimMap. This database, it's connect six components of TCM, such as the herb, ingredients, and also the symptoms, and also to the genes. So this can be used for translational bioinformatics, to help for the drug discovery of TCM. Also for the knowledge engineering approach, this is a approach developed or investigated in TCM. In TCM, mainly in the early years, such as the Guangyubo computer programs for diagnosis and treatment of liver disease. This is a typical TCM expert system. Expert system. This has been widely used in that year. In that year for about 30 hospitals. Then some of the general purpose TCM experts, such as GTS, and also the Monkey. Also the another expert system. I think it's about it's over hundreds TCM experts have developed in these years. Also another one is TCM ontology. Ontology will help to organize different concepts and the knowledge in TCM field. This is a example of the Guangyubo expert system. In that year, this system has been used by clinical settings, real-world clinical settings, and also you can see the precision has been reached about 80%, for this specific disease. Another one is ontology. Ontology. This is developed by traditional Chinese. It's a China Academy of Chinese Medical Sciences, which is started from the 2000 years and has been finished about 2004. And also one paper published in Artificial Intelligence in Medicine, can be has published and introduced this ontology, which is also widely used and currently in TCM field. This is the structures. Structures and the top level categories of the ontology. And also the semantic types and the semantic relationships that has been developed. Another one, I think, is it's a machine learning and determining approach, which is it's very widely used in TCM, and also including the classical methods and also currently the deep learning methods. Also include you can see that the complex network, which is especially used in TCM, because for TCM is also very typical complex system, about the formula, and also the diagnosis system. It's a complex system. So it's special that the complex network is very, very widely used in TCM. And for the clinical diagnosis, the applications, you can see that we have covered the related topics and the tasks such as the tongue, the pulse, and acupuncture, and also the herbal medicines, and also many diseases involved in clinical practice, such as the heart disease, the lung cancer, and also the and also another syndrome, and also such as stroke, liver disease, many chronic diseases have been they have used machine learning methods to help improve some performance for the diagnosis accuracy. And another typical researchers for clinical diagnosis is a latent structure approach, which is developed by Professor Zhang, which is from Hong Kong University of Science and Technology. He has spent about more than 10 years to develop the latent structure approach, which is derived from Bayesian network, and to especially used to find the symptom class, to discover the diagnosis structures from TCM. Another application is a clinical syllabus. You can see that from TCM syllabus, and typically the herbal prescription, which is very, very complex and very useful for TCM treatment. And also this is a main treatment, main kind of the treatment for TCM treatment. So there are many researchers for these applications, and also the clinical treatment, clinical decision support is also especially for to solve this problem, and also the prescription recommendation. This is also one of the subtopics in clinical syllabus researchers. And this is one of the TCM clinical data warehouse platform. This is one of the special related work, developed about 2007, and this is one of the platform to integrate the data warehouse and also ETL to integrate different data sources, and giving the ability for overlap and data mining and the statistics. Another one is syllabus is acupuncture. The similar method has been used for this task. And another one applications is pharmacological applications. For this field, you can see that we have focused on also the network, which can be considered as network pharmacology. One of the very distinguished professor is Professor Li, from Tsinghua University. He has developed many approaches and also some results for this work, and also this field which is very hot now in TCM, for pharmacological applications. Another one is the diagnosis. We want to investigate the underlying network mechanism or biological mechanism of TCM syndrome. TCM syndrome is one of the diagnosis, the main diagnosis of TCM. So we can see that many researchers have developed results and approach to investigate the underlying mechanism of the TCM diagnosis. However, you can see that we have developed many methods, and especially for TCM research topic, typically for the complex system. We can see TCM as a complex system for the treatment system and also the diagnosis is which can be considered as a complex system. But we can see some challenges and also it's the shortcoming of TCM artificial intelligence research. You can see that we still lack a high quality, large scale benchmark data sets such as the diagnosis, to develop the supervised learning methods. We lack the high quality, large scale benchmark data sets, and also for treatment it's similar. Another one is that we still lack a well-established knowledge graph, a knowledge base, to cover the accumulated knowledge, empirical knowledges in TCM field, because you know that we have many ancient books, ancient books for in TCM. This is they will embody very rich knowledge in TCM, but we have no established knowledge graphs, a large scale knowledge graph to embellish this kind of knowledge to support the clinical decision support system and also the expert system. Another one is that we also lack of the practical clinical support system for clinical settings. Now we have developed many different clinical decision support system, but which is not practical or not very useful, for the complex or real world clinical settings. So we need develop many different methods for the future, in the future, and we can develop a large scale, a high quality knowledge graph. And another one, we can use some reinforceable learning methods with effectiveness rewards. Because in our clinical data, the special lack information is the effective. This is an outcome information, which can be considered as a reward to feedback in the reinforceable learning, to optimize the syllabus. But we still need work to do this. Another one is a real-world clinical data mining for drug repurposing and novel drug discovery. This I think this will be a very interesting research direction. To help TCM to develop the novel drugs. Also, this will be help to the novel drug discovery for modern biomedicine, because many drugs they will derived from the natural plants. Another one is we can use translational medicine to connect TCM concept to biological entity, which means that we need to connect TCM to modern biomedicine, by the artificial intelligence methods, and also some of the big data methods. So this is a report. All my this is my report. Thank you very much. Okay, thanks.